Let's rewind a little. March 2020, the Wuhan virus had just reached India. The cases began to rise. The government imposed a swift lockdown. The restrictions lasted for several months. Millions of Indians stayed at home under lockdown. Some even chose to not step out until 2021 just to be safe. Now, during this period, a survey was conducted in India, a study on the many health conditions that Indians suffer from. And the findings of the survey have just been released. They show that between 2020 and 2021, Indians have become more prone to obesity, hypertension and diabetes. And the study links these conditions to lockdowns and restrictions, which apparently made these conditions worse. Why is this a big deal? Our next report tells you.
With more than 200 million cases and 5 million deaths, the Wuhan virus pandemic continues unabated. It's expected to cast a long shadow, not just in terms of loss of life or economic downturn, but also in the form of long-lasting health concerns, like diabetes, obesity and hypertension. A new study indicates that Indians have become more prone to all three in the wake of the pandemic. They've become more obese, more hypertensive, and are at a greater risk of diabetes. This study was part of a national health survey carried out by the Ministry of Health and Family Welfare. The last such survey was conducted in 2015 and 16. This one was conducted between January 2020 and April 2021. It involved more than 636,000 households, more than 724,000 women and more than 100,000 men. Once the survey concluded, data from the previous survey was compared with the new data. The comparison revealed that in the last 5 years there has been a marked increase in the proportion of adults suffering from obesity, high blood sugar levels and hypertension. Nearly a fourth of the men and women surveyed were found to be obese. A fifth of the women and a quarter of the men were suffering from high blood pressure. 15% men and 13% women were found to have high blood sugar levels. 57% of the women and 48% of the men were found to have a high waist-to-hip ratio. These symptoms were more prevalent among urban dwellers. 1/3 of urban men and women were found to be obese. 18% of men and 16% of women have high blood sugar levels, and a quarter of urban men and women have elevated blood pressure. The data also revealed that when compared to men, Indian women scored poorly on health indicators. They were found to be more anemic and overweight. Is this due to the pandemic? The survey doesn't rule out the possibility. It says that the health parameters also capture the impact of lockdowns and restrictions on the average Indian. But it does not mention if these health conditions were amplified due to the virus. It's a concern that we must bear in mind. This virus has proven to severely impact people who are overweight or suffer from diabetes. Now that it has mutated into a new variant of concern, there are chances that people could even get reinfected. It's yet to reach India, but the findings of this survey must serve as a wake-up call for all Indians. Bureau Report, WION, World is One.
WION is now available in your country. Download the app now and get all the news on the move.